Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. If you're having pain, give us a call, 866-870-5752. Okay. And we were just talking with Pearl, and she came in on another line, so hold on a second. Let me do this.
Pearl, you with us?
Now she is. Hi, Pearl.
Yeah.
Pearl, hang with us. I got to do a little bit here to get the show ready for the next half hour. Thank you for staying with us. First of all, I want to mention that what I do mainly is to stimulate new tissue to grow in the body, cartilage and tendons, ligaments, and fix the joints and neck and back pain, arthritis, you name it. And I use PRP, which is platelet-rich plasma, and stem cells from your own body. And I've been doing this kind of work, this regenerative medicine, since the late 90s, since I was at UCLA in my residency. I was doing it. And I did it because it worked on my body. I'm going to call it a miracle overnight cure after a failed surgery. And it's been a great life for me doing this, and a great life for most of my patients. It's not going to work on everybody. And I have to make it clear, I love surgeons. They do the hardest work in medicine. There's no question about it. But there are way too many musculoskeletal surgeries being done. And this is another way to take care of the body and stimulate it to recreate its own tissue rather than cut tissue out. We also do this type of work on the face to regrow the collagen in the face and make people look a lot younger. And it's called the vampire facelift. It's non-surgical. You come in, get your blood drawn or your stem cells and get injected in your face. Very simple, pain-free, and walk out looking younger. The other thing that we do is grow hair. We can stimulate the hair follicles again. And if you're totally bald, it's not going to work on you. But if you're thinning, it's a great idea. Same thing. We just inject these cells into the scalp. Now, Pearl, you've been good to me and you've waited, and we're going to talk about your daughter's wrist. So how old is your daughter? She's 50, correct?
Yes.
And how long ago did she fall down?
About 9 weeks ago.
Okay. And so at first they thought it was a sprain, and then they did an x-ray or something, found out it was a fracture. Is that correct?
Well, yeah, they took an x-ray right away and at an urgent care place, and they said it was a sprain. But
okay.
She went to her doctor, probably, I don't know, five weeks later, I'm guessing. And he just read the report of what the urgent care, technician said about her report. And so they let it, they said, no, just use one of those little balls to play with the Play-Doh and just keep squeezing it and stuff. And anyway, it wasn't getting much better. So finally she went to an orthopedist, and they sent her to a therapist the other day, this last week, and they told her that not to expect to really have much of a range, even after all the therapy that she's going to be going through. She has to go 3 times a week, and they gave her some exercises to do at home as well for her wrist, and it's her right wrist, and it looks bigger, it looks wider than her left wrist. And,
who was it that found? Who was the magician that found the fracture? The orthopedist?
Yes. Right.
And how did he do that? Did he get an MRI or did he get another X-ray or what?
No, he saw the X-ray. He saw the X-ray.
Oh, he just looked at the X-ray and said it was. Okay.
The other people did not, the guy from the urgent care did not give her good advice at all.
Okay.
And neither did, I guess, the family doctor or whatever it was.
Okay, so let me get this straight. So the orthopedist found a fracture that wasn't seen by the doctor at the ER or urgent care. Was the treatment any different after he saw the fracture?
I didn't understand that.
Did
Well, Well, yes, because they're going to be giving her exercises for her wrist
Okay.
to do at home 3 times a day, I think, and then they
Okay.
told her to use a heating pad
Okay.
afterwards. Or
So
something
there's
like
no
that.
major treatment because of the fracture. There's no surgery going to be done, and nothing of that.
none.
Okay, good.
But she refuses to believe that she is going to only have so much mobility. She believes that she's going to, in the future, have more because, they only talk about after all these physical therapy sessions, you're going to only be able to move your wrist as, I don't know.
Okay.
If
Pearl,
totally
I have the story. Ask the question. You called for a reason. What do you want to know?
Well, I want to know, is it possible to have it back to normal?
I don't know the answer to it. I haven't seen her.
Oh, I see what you're saying.
The good news is this, Pearl. The good news is if the fracture wasn't seen in the beginning, it's probably what we call an occult fracture, meaning it's not a big one. It's one that wasn't seen. And it probably is not the cause of the problem. The problem is most likely that she sprained her ligaments. And that's something that we can usually heal using platelets or stem cells from her body. I have to see her, move it around, touch it to tell her. This is not one that I can imagine over the radio and tell you what's going to happen to her. I have a crystal ball, but it doesn't work very well. Come on, Nita.
I gave you that crystal ball. It better work.
Yeah, it better work. It's not. I don't know how to use it. It didn't come with instructions. So, Pearl, there's good hope for your daughter, but I would get her into the office quick because we want to do the regenerative medicine with PRP or stem cells quickly before it heals the wrong way.
I see. And if it healed the wrong way, now this is at 9 weeks.
Well, 9 weeks is usually a pretty good healing time, but I'm going to tell you the truth. I've had people injured 50 years ago that have healed up from the work I do. That's 50 years ago. So I don't have any answers for you until I examine her. Then I'll be glad. Why don't you come in with her? Drag her in.
Okay, well, she's very, very, very busy. She has a very busy schedule. She's
well,
always,
good. Then she can live with her wrist the way it is. Everybody's busy. If she wants to get better, she needs to get checked out by somebody different who does something different.
Well,
I'm telling you that there's good hope that she can feel better, but I can't promise you anything, especially until I examine her.
I see. Okay. All right. Well, I'd have to talk to her about it. So, but that was the question I wanted to know. If
sure. I'm going to tell you, Pearl. It's very funny. I would say at least 20 or 30% of the people that come into my office are, quote, dragged in by their spouse or their parents or something like that. And they don't believe in this stuff. The patient doesn't believe in this stuff. They go, it can't work. I went to a surgeon. They said blah, blah, blah. And then we finally work on them. They get better. So I would tell your daughter not to wait. This is one that you don't wait on. That wrist is probably the most important joint she has in her whole body.
Yes. Okay, well, I will mention it to her. And
I'm going to tell you this. My wrist has been sprained to the point where I couldn't use it at all about 22 years ago. Okay? It was a golfing injury. I saw a video on how to hit a golf ball over a tree right in front of the person with a 3-wood. Now, 3-wood is a club that hits the ball about 230, 240 yards. So it happened to me. I got in front of a tree, and I had quite a distance to go to the green, and I hit down on the ball the way the video showed me, but I never hit the ball. I just hit the ground. And it really hurt. My wrist was hyperextended backwards. And I injected my own wrist a few times, and it healed up wonderfully. Wonderfully, wonderfully, wonderfully. And
how long did it take you?
I don't remember. It's so long ago. I know that I haven't had any pain since then. I can play golf, I can lift weights, I can do whatever I want to do. So my wrist is fine. I don't even have a scintilla of a shadow of a memory of what it felt like before, other than I knew that I couldn't use it. It was so painful. It was excruciating. But it's gone now. It's fine. I don't know if you've heard my story, but I've done my wrist, my right wrist. I've done both my shoulders. I've done both my knees. I've done what else? Both my elbows. I've had other practitioners do my neck and back because I can't reach back there. And anytime I injure myself, I inject myself. It's not a big deal.
Do you mind me asking you, how old are you?
I'm 72 and a half.
Oh, that's right. That's right. I just heard you say that, too, before I called. Oh, that's right.
But I'll be honest with you. I don't do age. I'm one of those people that I'm forever 16 years old. And I've got a real bounce. I've got a super bounce in my step, and I'm a very, very happy person. I meditate 1 hour every day of my life, and I go to that place of pure bliss, and I do my best to take that with me out in the world. I'm not perfect at it. I still have my moody times, but I work on it all day long. I think good thoughts, and I try to do good actions. I say I try. I can't do it all the time. I'm not, I'm still human. But the meditation helps me quite a bit. And in that state of bliss that I go to, I'm 16 years old. Always, every day I'm 16 years old. So I'm very active in sports. I run the golf course. I play at a place called Mountain Gate, and they call it Mountain Gate because it's in the mountains. And last weekend, I actually ran the whole course.
Wow.
I love it. I love motion, and I'm not going to let anything get me down. So when something hurts on me, I inject it, and it gets better.
Well,
Nita got better. She had neck pain. Nita, tell her.
I had intractable neck and shoulder pain. I was with the chiropractor for many months, and one day he fired me, and we had done pictures. We had done every, MRI pictures, everything, and he said, we're done. You need surgery. So then I heard about Dr. Darrow, and I phoned him. You called me back at 10:30 on a Sunday night because it took a while for you to get my message, like 2 days or something for some reason, and you called me like on a weekend and said, get in my office at 9 o'clock tomorrow morning. That, was amazing. I would have gone to the ends of the earth when I heard that. And so you injected me that day. I was better in 1 week after months of pain. 1 week, pain-free.
So, Pearl, we're not telling you this is a miracle therapy. We're just telling you our experiences. It fails on a lot of people. It's not something that works for everybody. And the reason mostly is because people don't work it. They don't leave the area alone after I inject it, or they don't get enough treatments. They do it once and they go, it didn't work. Well, I go, you didn't work it. Or they'll go out and play golf 3 times in a week after I do their knees and go, it didn't work. And I say, you didn't work it. It takes time to heal. It takes time to grow tissue. It's not a miracle. It's just what works.
Okay. Well, thank you very much for your
Get a lasso and rope your daughter in and drag her over.
Okay.
I'll tell you something else. If you want to have her call me, you can have her call me directly and I'll talk to her.
Okay. Well, I will tell her. I'll mention it to her and see what she says.
And I'm happy to talk to anybody who wants to at midnight because I'm usually up doing emails then.
Okay. Well, thank you very much,
Pearl.
Doctor. Thank you for taking
All right. God
my
bless you and your daughter. And thanks for calling. I appreciate it. It was a lot of fun.
Mark with a K.
Mark with a K. This is Dr. Marc Darrow with a C. How are you today?
Good. How about yourself?
I can't hear you, sir. Got to yell at me.
A little louder, Mark.
I'm doing good. How about yourself?
Oh, I'm doing good. Thank you. Yeah, talk a little bit louder because you got kind of a deep voice. How long has your back hurt you for?
About 6 months.
Okay. Was there an incident or it just happened by itself?
A lot of basketball. Weekend warrior.
Okay. Oh, good for you. Good, good, good. Did you happen to fall down, or you just the typical pounding from basketball got to you?
Yeah, typical.
Okay. So in those cases, probably 99% of them are a ligament sprain. And the ligament, if you want to write this down, the name of it is called the iliolumbar ligament. You can look it up on Google. It's also a spot where the quadratus lumborum muscle attaches to the pelvis. And there is a fascial layer that attaches there, the thoracodorsal fascia. So in the low back, it's usually very easy to heal those up. I've had it before myself, and I've injected it with regenerative medicine and gotten better from it. I'm doing great now. I can play golf and run and all the twisting things without any pain. So there's good hope, just you telling me the way it came on and where it is, that we can help you heal that up. Do you have any other questions about it?
Yeah, sure do. Thank you. I noticed just by reading some stuff, it says it takes a couple injections. What's the average that you see, like just from your own, you say you've been doing it for a while, like what's the average, like normally how many injections does it really take for like a body part to actually get better?
It's different for every body part. If somebody has very advanced arthritis in a hip joint and they can't move their leg, that could take a long time. Low back pain, when it's ligamentous, or what we call an enthesopathy. And that's Nita's favorite word.
It
Nita,
is,
I'm
and
stump
I can
you.
define it. It's the attachment of a bone to a ligament or a tendon. Mark with a K.
Wow, yeah.
And Nita, why don't you spell it for everybody so they can Google it and look it up?
I think it's ENTHESOPATHY.
Bingo!
Do I get a raise?
Yes. So everybody look that up, because most of your pain is from an enthesopathy. And they're easy to fix. It's just where tissue attaches to bone. So all we do is we inject in those areas and we stimulate the body to produce thicker ligaments. They get about, I'm trying to remember what it was in a study. They get about 400% stronger and about 100% thicker. So when we inject in those areas, we're bringing a blood supply there, and fibroblasts come to the area, which are cells that really grow new tissue. With platelet therapy, PRP, we're actually stimulating tissue to grow, and with stem cells, the stem cells become tissue. So there's a lot of different ways to skin the cat, as they say, and I think there's great hope. I have to examine you first, Mark, to let you know if I'm thinking the right way. But from what you're telling me, that's all it is a sprain. Since you're a basketball player, Mark, you've sprained your ankle before, correct?
Never.
Wow, that's amazing. Most of us that run around sprain our ankles at some point or other, and it hurts real bad, but you don't go get a surgery for an ankle sprain. And you shouldn't get a back surgery or neck surgery for a sprain. And most of the pain that people have is from sprains, not all of it. I mean, if you break a bone or something, or you have a pinched nerve that's making your arm or leg weak, or it's numb, you better think about a surgery. But most of the surgeries done are not for those things. They're for things that shouldn't have a surgery. And most of them fail because they're not the right thing.
When you say regrowth tissue, are you talking like is that instant or is it a process?
Say that a different way. I didn't quite hear you.
When you say it helps regenerate the tissue with the with the PRP, does that take a couple of weeks or like how?
Oh, I see. Well, the studies show when we do a biopsy about day 3 after the injection, we see new tissue growing. How long does it take for you to feel better is really your question. And that's something I don't have the answer to. With low back pain, if it's a ligamentous sprain, it's typically going to be like about anywhere from 2 to 6 weeks.
Oh, okay.
And typically, I'm going to inject for the. Yeah, go ahead. Sorry.
Yeah, sorry. That's 2 to 6 weeks with like one injection, or are you talking multiple?
It depends.
Okay.
If you come back after injection 2 weeks later which is what I ask patients to do. They don't always do that. And you're still in the same pain, I'm going to ask you to do it again. And it's usually, you say averages. I don't know averages. I'm going to say for low back pain, neck pain, it's usually 1 to 3 treatments. But I'm not putting any guarantees. If you come in the office, you're going to sign a consent form saying there's no guarantees.
Okay. And when if that doesn't work, do you go back to prolotherapy? Or you just...
No, you're kind of jumping the gun. I've got to examine you first and see if we're thinking the right way, and then we can talk specifically about you. It's not a recipe. Everybody is done differently.
Yeah. Okay.
I wish it were in a cookbook.
Yeah, you know what? One more thing. I mean, I know you said your age earlier. Do you take what's your daily recipe, man? I mean, is it certain vitamins
first of all, I eat mostly ketogenic food, which is low carb. So I'm skinny. I'm 170 pounds, almost 6 feet tall. I'm shrinking a little bit. I take testosterone. Okay, I do that once a week.
Okay.
And I exercise a lot. That's basically it.
And is beer considered ketogenic?
Beer is anti-ketogenic. Ketogenic just means that you stay away from carbohydrates. And the way it works is simple. If you eat a carb, your insulin jumps up. When your insulin jumps up, you become inflamed. You also take in a lot of fluid, and you store fat. Insulin is the hormone that stores fat. So when someone walks in the door, I know what their insulin level is by looking at their tummy. And I know what they eat.
Okay, so I guess C's candy isn't ketogenic either, now.
I beg to differ.
Yeah. That's
hey, look, you got to admit, there's nothing on the planet like C's candy. It's great, but it's just not very healthy. It's not good for us.
Yeah, that's pretty much my diet. Beer and C's candy, so maybe that's the problem.
You got a good life. And basketball, you're in heaven, man.
I'm in.
Yeah.
We'll join your club.
Absolutely.
So I'm going to tell you a story. One of my best friends, he won't mind if I give his first name. His name is Randy. Came in the office. He'd fallen on his knee. And I said, I'm not going to help you. And he goes, what? We're best friends. And I go, sorry, you weigh 317 pounds. No matter what I do for your knee, my treatment won't work. And he said, well, what should I do? I go, you go keto. And guess what? He's down to about 260 now in about 6 or 8 weeks. I don't know. He has lost, I don't know how much weight, but as soon as he agreed to do the diet, I started treating his knee. Why should I be a loser and have the patient be a loser? When you are having excess weight on your body, every extra pound is 5 pounds on your knee. So if you are 50 pounds overweight times 5, that's 250 extra pounds on your knee. Oops. We got to run. Let's go. I'm going to give you out the website. It's www.lastemcells.com. The office number is 800-300-9300. Please get a hold of me. I love you all.
Thank you, Mark, and thank you, Mark, and thank you, Alex. Thank you, Suzette. I'm your host, Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.